Somatics is not yoga. Somatics is not mindfulness. Somatics is not an add-on to therapy. So, what is somatics? That is really hard to explain. Like, you actually have to try it on. First, begin by noticing the breath. If you feel your shoulders rising and falling, you might encourage them to soften down. Just notice the breath. What is here? Whew.
We are an organization in service to the nonprofits who are based in and serve Essex County. We were actually getting a lot of requests in terms of support, like how do we do this? How do we build more equitable, inclusive organizations? How do we contribute to the more just world that we all deserve? And so we came to Trinity OEP to explore what we could do to support leaders and teams.
Why come to OEP for this work? Well, oftentimes people are espousing values that they really care about, but actually embodying the values are different than espousing the values. In terms of our OEP work that is designed towards racially equitable shifts and change, we all embody racial bias. So we want to start to become familiar with what that is. We start at somatic awareness. We often ask, what is your mood? We are working with and through the body because we see the body as the self in all that comes up there. Sensation, emotion, what you have the capacity to do. What meaning are you making of something? Soma equals self. The somatics is the philosophy connected to this theory of change on how you change the self. To be more choiceful. That's what this is. Give you more choice. It's about building your capacity.
I think developing more embodied leadership skills and practices allows for healing in that, there's a bit of reflection that is required. There is some intentionality in terms of how one relates with other people across difference. And so I think becoming more aware of how external systems, structures, societies have shaped us might influence the way that we show up. And interrupting anything that is not in alignment, I think, absolutely will lead to healing.
I'm good with hands. Wonderful.
I identify racially as, second, and this means to me.
I identify racially as white. To me, this means, I'll go with confusion.
Even after only 2.5 sessions now, I've gained confidence in my ability to talk about me and my own personal experience in my body, to talk about race, to talk about the difference between race and ethnicity, to look somebody in the eye and say, I'm ready for an honest conversation, and I might screw things up, and I hope that I don't, but that I'm coming into this conversation in a genuine desire to make a connection.
So EC RELC, year one, we focus on really allowing leaders to understand themselves as value-driven leaders, to help them understand from a systems level where they're trying to change towards racial equity. For year two, we do more personal work, go deeper, start to look at how are my values showing up as someone who's been racialized in the world.
The facilitators are really validating. Sometimes we don't talk about our trauma. We just suppress it, and to be in the moment and allow those emotions to be there to the point of crying. Like, I felt like I unpacked stuff that I had been packing for a long time, and it felt empowering. I have 300 employees, 5 divisions, and like 19 programs. I have to switch hats every 5 minutes. And sometimes when you're doing that without paying attention or centering yourself, you can make really poor decisions. Focusing on your emotions, on centering. It's this self-awareness that you have as a leader that allows you to sort of have compassion. And I think that that's the piece that I like the most.
Thank your partner. Thank your partner.
Being able to witness not only the transformation that happens with those that we're in sessions with, we have someone right now who has immediately started to integrate them into their work.
I'm the Executive Director for Children's Friend and Family Services, which is the division of JRI working in the Northeast of Massachusetts. We work with kids and families, mostly who've experienced trauma, and we have very diverse sites, very diverse communities that we serve. I was fortunate to come to this with a cohort of leaders and colleagues from my own division. We've been working actively to come back, teach, practice with our own staff, and then encourage them to bring it back to all of the different sites and programs that we oversee. If we as leaders can practice this work, we can then be better supervisors, our clinicians can be better therapists, and we're modeling for the kids and families that ability to be present.
We didn't anticipate that someone would, this early in this new initiative, decide, you know what, we're gonna start right now. Now, of course, that is the hope, that everyone that is taking these courses brings it back into their organization, and that it then gets extended to those that they're serving.
And as you feel that energy coming up into your body, you can kind of bend your legs a little bit. You don't have to be still. Kind of feel what your legs feel like connected to those feet and feeling that energy.
We're around so many intense emotions, hearing the stories of trauma from the individuals and families that we work with. And when we're in tune with how we're really feeling and then able to express to the people that are around us, I think it creates much more of an authentic relationship. It creates trust. And you can't do anything without trust.
Doing this work as adults is super important for those working with young people. Young people are gonna know if you're being authentic with them, if you're being real, and if they feel safe or not. So if we genuinely want to impact outcomes for young people, we have to start with adults.
I think somatics are important to bring into any diversity, equity, inclusion, and belonging practice or initiative. It's a bit of a pet peeve of mine that people look at things as checkboxes and to not see this work as something that's on a strategic plan that you have to say, yes, we did that. The answer should never be yes. It should be we are doing it, not that we have done it. And I think that the somatics practice brings it to that next level.
This is long-term work, and so the hope is to build that community and that it would outlast, right, the formal programmatic piece.
I just want to say thank you to be here and to learn so that we can deepen the work in our own organizations and within the region, because it's not just our organization, we're all connected. So I just wanted to say thank you for that opportunity.